Hello there! Once again, welcome back to the Coco campus. Today, let us study about the muscles that are present on the femur. If the femur is the pillar of the thigh, the muscles are the high performance cables. We are splitting the thigh into three rooms. The anterior, also called the kickers, the medial, also called the squeezers, and posterior, also called the pullers. Each room has its own landlord, I mean the nerve. If you remember FOS, femoral, obturator, and sciatic. So, without further ado, let's break into the anterior compartment, the power kickers. Let's look at their innervation first. Femoral nerve. So, once again, the innervation of the anterior compartment, the power kickers, is the femoral nerve, L2, L3, and L4. Without further ado, let's move on towards the first muscle, sartorius. Its origin is at the ASIS, interior superior iliac spine, anterior superior iliac spine, and its insertion is at the pes anseres. Pes anseres and serines, if you want to be specific. Also, the medial surface of tibia. Okay, and what does the sartorius muscle do? It helps flex the hip and knee, and also lateral rotation of the hip. It helps flex the hip and knee and lateral rotation of the hip. Okay, so let's go on towards our next muscle, the iliopsoas muscle. Thinking of the iliopsoas muscle, let us look at the greater psoas. This is your greater psoas muscle. And this right here is your iliacus or iliac muscle. Let us look at their origin. Their origin is at T12 to L5 and iliac fossa. T12 to L5 and iliac fossa. Its insertion is at the lesser trochanter. So what do? They are the chief, the major flexor of the hip. So iliopsoas, T12 to L5 and iliac fossa, insertion lesser trochanter, and action chief flexor of the hip. Let us move on towards the next muscle, which is part of the quadriceps. Your first muscle, part of the quadriceps, here you've got four muscles, right? So the first muscle is rectus femoris. Its origin is at the AIIS, anterior inferior iliac spine. Its origin is the AIIS, anterior inferior iliac spine. Its insertion is at the patella via the quad tendon. patella via the quad tendon. And what do? The action is pretty simple. Flexes the hip, extends the knee. Flexes hip and knee extension. Simple, right? Okay, and then we have a group of three muscles sharing the same name. You have your vastus medialis, you have your vastus lateralis, and you have your vastus intermedialis. Their origin is at the femoral shaft, or should I say, linea aspera. So, vastus group, lateral, medial, intermediate. Origin is at the femoral shaft or linea aspera. The insertion is once again patella. And same as rectus femoris, it's via the quad tendon. That's why they form the quadriceps. Okay, what do? What's their action? Extension of the knee. They just extend the knee. Okay, let me help you with a mnemonic. Sartorius is the tailor. It helps you sit cross-legged, flex, abduct, lateral rotate. Rectus femoris is the only quad that crosses two joints. ACIS for tailor, sartorius, AIIS for the kicker, rectus femoris. And also, another clinical significance is the patellar reflex, L3, L4. They test the femoral nerve. 5, 6 pick up sticks for the arm, but 3, 4 kick the door for the knee, if you know what I mean. Okay, moving on to the medial compartment. The adductor adducts. Your first muscle here is your adductor longus. So before we talk about the muscles, let me tell you the innervation. It's the obturator nerve, which is L2, L3, L4. Alright, so your medial compartment, adductor adducts, is innervated by the obturator nerve L2 to L4. So, looking at the first muscle, adductor longus, adductor brevis, and adductor magnus. Wow, this dude is huge, right? Usually you just have longus and brevis, but here you've got a magnus too. And gracilis on the medial side. So let us talk about their action. All of them adduct the thigh. Simple. Bringing those knees together. Right, so you have adductor longus, adductor brevis, adductor magnus, and gracilis. What do? They adduct the thigh, bringing your legs closer together, bringing your knees together. The gracilis originates at the pubis and inserts on the medial tibia, pes and serinus. Gracilis originates at the pubis and inserts on the medial tibia, pes and serinus. Moving on, there is a trap here, a dual innervation trap. So let us talk about the pectineus muscle. Now, the pectineus muscle often gets a bonus nerve from the femoral nerve. So even though they're all innervated by the obturator nerve, sometimes your pectineus gets a bonus nerve from the femoral nerve L2, L3. And also let's go to adductor magnus. Who is a double agent. For the adductor part, it's the obturator nerve. And for the hamstring part, a tibial division, sciatic nerve. However you'd like to pronounce it. Sciatic, sciatic, it makes sense. Just go with whatever you like. So, the mnemonic is am-so, adductor magnus, sciatic plus obturator. Am-so. Adductor magnus equals sciatic plus obturator. Okay, moving on towards the posterior compartment, the hamstring heroes. Let us look at the biceps femoris. So, once again, before we go into the muscles, let's talk about who is innervating them. It's innervated by the sciatic nerve, L4S3. L42S3, to be clear. Okay, so biceps femoris has two heads. Long head from the ischial tuberosity and short head from linea aspera. Once again, biceps femoris has got two heads. Long head from ischial tuberosity and short head from linea aspera. Okay, so the hamstring contains three major muscles, right? Let us move on to the next muscle, your semitendinosus muscle. It is a long, cord-like tendon and it inserts at pes and serinus. It has a long, cord-like tendon, inserts at pes and serinus. Moving on to the next muscle, you have your semimembranosus muscle. It is flat, membrane-like, and it inserts on the medial condyle of tibia. Alright, so hamstring muscles, there are three of them, biceps femoris, semitendinosus, and semimembranosus. What do they do? What's their action? The action is quite simple. They are the extensor of the hip and flexor of the knee. So, hip extension, knee flexion. Simple, right? Extensors of the hip and flexors of the knee. Now, let me give you a high-yield fact here. All hamstrings originate from the ischial tuberosity or ischial tuberosity, however, whatever suits your fancy, I guess. Except the short head of biceps femoris. Short head of biceps femoris is from linea aspera. Rest all of them originate from the ischial tuberosity. Okay, now let us go to the money round, spaces and signs. The femoral triangle, sail. For boundaries, you have the sartorius, adductor longus, and inguinal ligament. Sail, right? Sartorius, adductor longus, and inguinal ligament. And for the femoral triangle, another thing to remember is navel. Lateral to medial, you have nerve, artery, vein, empty space, lymphatics. So, sail for boundaries, navel for contents. Simple. For boundaries, you have sartorius, adductor longus, inguinal ligament, and for contents, lateral to medial, you have nerve, artery, vein, empty space, and lymphatics. Then, let us go on to just something very simple. It's not really that necessary, you gotta know, but it would help. The pes ansernis. We talked about it a lot, right? So I suppose it would be good if you know what it is. The goose's foot. Three tendons from the three rooms meet on the medial tibia. Mnemonic SGTFOT. Surgent fought. So sartorius, femoral nerve, gracilis, obturator nerve, and tendinosus, tibial or sciatic nerve. Simple enough. Also, there's something known as sciatica. The piriformis muscle can compress the sciatic nerve, causing a literal pain in the butt that radiates down the leg. That's your sciatica. Alright, so this is it. Quick recap: anterior femoral, medial obturator, posterior sciatic. Watch out for the double agent adductor magnus and remember your surgeon fought at the knee. I hope this helps you, and I'll see you again with another amazing quick video. Until then.